half of those kids, that Buffett rule would help pay for the SNAP program. Is it insignificant now? Yield back the balance of my time.
I thank the gentleman. It's, my God, what we could do if we had the will to do it, and that's what this is about. It's a question of our values and where our priorities are. Is it about our kids, or is it about the richest 1% of the people in this nation getting $150,000 or $187,000 in a tax break? The gentlewoman from California has been extraordinary in her fight for the food stamp program, and she hasn't been afraid to take on anyone in any party on this issue of making sure that the food stamp program is secure. We recognize the gentlelady from California, Ms. Lee.
Thank you very much. First, let me thank my colleague, Congresswoman DeLauro, for yielding for those kind words. But let me just thank you for not only organizing this special order, but for really continuing to beat the drum so that the country can understand how important nutrition programs are to our nation. And this is not just a job for Congresswoman DeLauro. This is about her life's work. So I just have to thank her for her leadership. Republicans are preparing to attack families on food stamps. They're planning to take an axe to one of the most important protections for the poor, children, seniors, the disabled, which is, of course, the Supplemental Nutrition Assistance Program. They're attempting to cut up to $33 billion from critical anti-hunger programs, even, mind you, as they bring up this bill, H.R. 9, the small business tax cut, which is another $46 billion tax holiday for the wealthy, for the very wealthy. They're trying to bring this up at the same time. When Republicans target programs that protect vulnerable Americans from massive cuts that risk making millions of children suffer hunger and deprivation, they're doing so, unfortunately, in the name of fiscal responsibility and deficit reduction. Yet in the very next breath, when they want to give away tax breaks to the already wealthy businesses, then those same deficits don't seem to matter. Mr. Speaker, making cuts on struggling families during hard times is not only heartless and mean and immoral, but it also makes no sense because it doesn't reduce the deficit nor create jobs. Critical programs like SNAP and WIC not only feeds hungry children and families, but it supports the overall economy. Every single dollar of SNAP benefits generate $1.84 in economic activity. And the Congressional Budget Office rated an increase in SNAP benefits as one of the two most cost-effective of all spending and tax options it examined for boosting growth and jobs in a weak economy. Now, let me tell you, today I really have the privilege to speak, and Congresswoman DeLauro, I want to say to you thank you again for this, because I know, as I said earlier, this is your life's work. This is not just about your job, okay? This is about you as a human being. This is about us and our values. But let me tell you, many years ago, while I was raising my two small children, two little boys as a single mother, I fell upon some very difficult times, like Congresswoman Woolsey, and she encouraged me to talk about this when I came here, because you know what? I was so embarrassed. I never talked about it until Lynn Woolsey encouraged me to begin to share my story. But I had to go on food stamps to help me just feed my kids during that very difficult period in my life. And it was hard. And again, I was very embarrassed. But to this day, mind you, to this day, I want to thank my government and the people of the United States for extending this helping hand to me as a bridge over troubled waters. Even though I was embarrassed and didn't want to be on public assistance, I had to for a while. And it was not that, you know, I was a welfare queen, you know, but this was a very difficult time. And most families, 95, 98% of families, don't really want to be on food stamps. They want to trade their book of food stamps for a living wage paycheck. That's what they want. And so cutting SNAP, it simply doesn't make any sense. There are still 4 job seekers for every 1 job in America. And so we can't cut the benefits that help to keep food on their tables and provide that bridge over troubled waters until they can get their job. For the life of me, it's really hard to understand how people of faith, you know, have forgotten what the scriptures say, that we are our brother's keepers, we are our sister's keepers. This is the United States of America. This is not a poor, developing country. What this Republican budget proposes will create a country that we won't even recognize. One that says, go for what you know. One that says, I got mine, you get yours. This 11% cut in food stamp, which the Republicans propose, it says you're on your own, mind you. You're on your own unless you are very wealthy. So I know the American people, though, aren't going to go for this. Our values as a country won't allow this kind of cut in the SNAP program. Americans care about the common good. And so I am confident that they're going to, the Republicans, the Tea Party Republicans, they're going to hear from the American people on this. And so, Congresswoman DeLauro, once again, I just thank you for giving us the opportunity to do this. I thank you because it is a privilege to be able to stand up for the 46 million people who need this helping hand as one who needed a helping hand at a point in my life, and it helped me to live the American dream for myself and for my family.
From California, and I want to make sure that we have the opportunity to hear from three more of our colleagues, and our colleague from New York, Congressman Tonko, and thank you for being here tonight, and then we will hear from Congresswoman Schakowsky and Congressman Larson.
Thank you, Representative DeLauro, and thank you for leading us in what is a very important hour of discussion as we address some of the critical choices before this House. And as my good friend and colleague Rosa DeLauro from Connecticut indicated, our budget outcomes are a sum total of our priorities. What has value in our society? What are those sensitivities that we express? What are those outright requirements, basic foundational requirements of our society? I would suggest to you that one of those basic needs is to enable people to have the soundness of nutrition, to enable us to feed families that have stumbled across difficult times. And so what we have at risk as we speak here this evening on this House floor is a Supplemental Nutrition Assistance Program. The SNAP program touches 1 in 7 Americans. That is a staggering statistic. And for every $5 in new SNAP benefits that we offer, they generate as much as $9 in economic activity, almost a 2-time economic factor. And in my home district, in upstate New York and the capital region, some 23,000 households are utilizing SNAP funds. 1 in 4 of those SNAP recipients are 60 years old and older. And then we also have situations where 3 in 4 have had at least one member of the family work in the past 12 months. We have many children. 1 in 2 on SNAP are under 18 years of age. This tells us there's a growing need out there. We've had a tough economy, and people have stumbled across tough times. Why is this so important to discuss right now? Because before the end of this month, there will be an effort made through this House. They're asking that the Ag Committee come up with cuts that are brutal. They're asking for the Ag Committee to come up with a sum total of $33.2 billion. Put right onto the chopping block our SNAP funds. So we're affecting the weakest amongst us, the most hungry amongst us, and we're not recognizing that those dollars invested in these families will recirculate into our local regional economies. This is a sound program that ought to be continued. There needs to be sensitivity shown. There needs to be prioritization of a very important factor here. That is sound nutrition for our American families. I've seen it. I've witnessed it firsthand in our district. It works. It works well. We need to set this as a high priority. And I thank Representative DeLauro for allowing me a few moments of time to share concerns on behalf of the good people that I represent in the 21st District of Upstate New York.
You represent them well. I thank my colleague. I want to be in a trench with the gentlewoman from Illinois, Congresswoman Schakowsky. She is a tough fighter, and at the base of that is about families and their children. Congresswoman Schakowsky.
I thank you so much for the opportunity to participate in this debate where so many of our colleagues have come down to the floor to talk about it. This is the richest country in the world, and yet 1 out of 5 of our children is considered food insecure, goes hungry. That is such a moral outrage. You know, the average food stamp benefit is $1.50 a meal. That's what you get when you're lucky enough to be part of the SNAP program. And as this chart shows, this map shows, it's everywhere. I actually live in a district that was considered one of the least hard hit by food insecurity. But that's all relative, because the 9th Congressional District in Illinois, more than 11% of the households are experiencing food hardship, the inability to put enough food on the table. And even the least of the hard-hit districts has 7% of its families unable to put enough food on the table in the richest country in the world. It's intolerable. You know, the headline today in Politico, Republicans Axe Aid to the Poor, makes me so sad. Who are we as a country? What are we as a country? Where a candidate for president, and the Republican candidate for president, denigrates Barack Obama by calling him the food stamp president. I'm proud that this president wants to defend, protect, and save a program that feeds so many people. And here's what the Catholic bishops say. SNAP, also known as food stamps, helps feed millions of households. At this time of economic turmoil and growing poverty, the committee should oppose cuts in this effective and efficient anti-hunger program that helps people live in dignity. I know we're almost out of time. I just want to say we're asking for dignity for Americans that are struggling. The average food stamp recipient is only on it for 9 months. One of the former recipients called it a trampoline that helps you get past it. I'm asking for dignity for Americans and saving the nutrition programs, especially the SNAP program, the food stamp program. Thank you.
I thank the gentlelady, and it gives me really, I'm delighted to be joined by our my colleague from Connecticut, who's chair of Democratic Caucus and whose career, whether it was in the state Senate in Connecticut, in our legislature there, and his work here has been remarkable, and at its core, again, are our children and our families. I would like to recognize Congressman John Larson from Connecticut.
I thank the gentlelady from Connecticut and the dean of our delegation, the deaness, I guess I should say, for her tireless work and advocacy on the part of not only the citizens of the 3rd Congressional District in Connecticut, but across this great nation, and I dare say this globe. I never cease to be amazed by the eloquence of our members, so many of them coming forward and speaking their minds and speaking from their heart about the people that we're sworn to serve and represent. This week in Congress, we face, again, legislation, rather ironically, where we're deeming a budget passed, almost as though we would deem that the hungry be fed. Franklin Roosevelt, in another time, recognized the great sacrifice that a nation had to endure, and President Obama, this past January, called upon the shared sacrifice that is required amongst a nation that needs to pull together in a very difficult recessionary time. And in this time, it's a time where you have to make choices, and those choices have to be based on your values and have to be based, as the President said, on sacrifice. Roosevelt called for the warm courage of national security that comes from a shared sacrifice. 46 million people receive assistance, primarily women and children who get fed and nourished. We're going to have a debate on a budget that strikes at the core of this at a time when we would give tax breaks of $47 billion while we're taking away from the neediest amongst us. Roosevelt said the problem with our colleagues on the other side is they can become frozen in the ice of their indifference towards their fellow citizens, everyday Americans, searching and struggling in this recessionary period. And what do we get in return? We get Romney Care. We get tax breaks for Bain Capital. We get tax breaks that are coming to the nation's wealthiest 1% at a time where we ask the middle class, who is struggling to pay for it, We're out here today talking about a very important program that provides nutrition to the least amongst us. And we're calling for cuts that are not only going to take from them, but are going to take from students that are trying to be able to pay off their educational loans. This has got to stop. We're a better country than this. I commend the gentlelady from Connecticut for bringing this to our attention and focusing on the needs of a great nation that in a time of budgetary concerns has to choose the appropriate values for the country, who has to make the appropriate choices. We all agree in the need to sacrifice, but it has to be shared and shouldn't be balanced on the backs of the middle class and the poorest amongst us. I thank the gentlelady from Connecticut for her leadership.
I thank thee.
The gentlelady's time has expired.
I thank the gentleman, and I thank my colleagues for joining us tonight. Thanks, John.
Under the Speaker's announced policy of January 5th, 2011, the gentleman from Louisiana, Mr. Fleming, is recognized for 60 minutes as the designee of the Majority Leader.
Mr. Speaker, I appreciate you allowing me to speak tonight in this hour that I and my colleagues who will be joining me very shortly, other physicians who are from the GOP Doctors Caucus, perhaps nurses, other healthcare workers as well. In this next hour, we're going to be talking about our favorite subject, and that is healthcare reform. We're going to be talking about specific aspects, things that have actually come to light to us that I think are important. We're going to have other things that in the coming days we're going to learn about how Obamacare was passed, what things were done by the other side of the aisle to make that happen, things that maybe some would call sausage making. Others would say it's improper, but we'll certainly spend some time on that as the days come. I want to continue a theme that we've been discussing, and that is the broken promises of Obamacare. Remember that to get Obamacare passed, that President Obama made a number of promises. And I'll start with the first one that is relevant to our topic tonight, and that is, under my plan, no family making less than $250,000 a year will see any form of tax increase. And that was candidate Obama, Senator Obama at the time, who talked about all the number of things that were going to be good about Obamacare. But in fact, we see that virtually everything that's come out, with a few possible exceptions, have not been so favorable. And I think that taxes is really a very relevant subject to speak about this evening, because here we are, today is the tax deadline for the IRS, and we all have that on our minds. And you know, it's interesting, whenever I file my taxes, the first thing I think about after doing that is projecting into the next year. what are the issues going to be for me in my taxes. And so I think it's only proper that, and the timing is excellent, that we talk about that this evening. Remember that candidate Obama pledged he would not raise any of your taxes and promised not to tax health benefits. His health care law broke those promises at least 10 times. Here's just a lineup of some of the taxes that we're talking about. $52 billion in fines on employers who do not provide government-approved coverage. Remember that under Obamacare, not only is there a mandate for individuals to buy insurance, health insurance, there's a mandate on the employers, the business owners, to buy it as well. And upon both is the burden to buy not health insurance, but government-conceived health insurance. That is, health insurance that the government, in its wisdom, our federal government, decides and deems is proper for us. And so you have to make two fulfillments in that mandate. One is to buy health care insurance, and number two, health care insurance that's approved by the government. $32 billion in taxes on health insurance plans. The actual health plans are going to be taxed as well. Now, who is going to pay that tax? Do you think the insurance companies are going to pay it? No. It's going to be passed down to you, the subscriber, as taxes always on business make their way down to the consumer. $5 billion in taxes from limits on over-the-counter medication. $15 billion in taxes from limiting the deduction on itemized medical expenses. $13 billion in taxes from new limits on flexible spending arrangements. $60 billion in taxes on health insurance plans. $27 billion in taxes on pharmaceutical companies. $20 billion in taxes on medical device companies. $3 billion in taxes on tanning services. $3 billion in taxes on self-insured health plans. And $1 billion in new penalties on health savings account distributions. The health care law also includes a high income tax. That, because it's not indexed for inflation, will eventually hit 80% of taxpayers. I draw my colleagues' attention to this slide, Obamacare's rising tax burden. You can see that the tax burden in 2012, the year we're in, $190 for a family of four, that's $15 billion. And you see that the burden goes up each year, that in the out years, 2022, it makes it above $150 billion. 2032, the burden goes well above $250 billion, and it finally tops out at $320 billion total, and that's an average of $3,290 for a family of four. So what am I saying? Remember that when you hear the rhetoric from the other side of the aisle, it talks about how we should be having more sacrifice from the wealthy, more sacrifice from those who make more. Folks, we've been down this road before. Remember the luxury tax that came out some years ago? What did it do? It killed the companies that made boats and luxury items. It created a lot of job losses. The people who were hurt were the working class people, not the wealthy. They can still buy those things any place they want to. We also came up with this silly idea of an alternative minimum tax, making the wealthy do their fair share. Well, we have the ATM today, and where has it got us? Because that was never indexed for inflation, middle-class people are being hit by the alternative minimum tax. So it's no longer a tax on wealthy. It is a tax on the middle class, the people that our colleagues on the other side of the aisle talk so fondly of. And that's an important point, and that is that every time we come up with a tax on the wealthy, it always makes its way to the working class and the middle class. Now, why is this? Is this by accident or is it by grand design? Well, folks, we all know that inflation occurs every year at an average rate of around 3%, but it's been as high as 16% in our history. And so anytime we have a tax law that affects people with a certain income, we know that automatically over time people with lower and lower incomes, because while their absolute dollars in value are going to go up, the truth is the purchase power of those dollars go down. So that pushes more and more people of lower and lower income levels into higher and higher tax brackets. And so again, our colleagues on the other side of the aisle, they love all of these taxes on the wealthy, but they can never make enough money. We've heard about recently in days the infamous Buffett tax, the Buffett rule that would require super wealthy people to pay some additional tax or whatever. And their own side agrees that would only add about $4 billion per year, not even a drop in the bucket, less than 1% of the annual deficit. So why is that important? It's important because if you're going to get more income from taxes, and I would argue that you never really get more income from taxes, but if you think you can only do it when you spread it out among the middle class and the working class. And the way you do that, kind of the silent way, the camel nose under the tent, is to pass it on the wealthy first, and then through inflation is passed down to, albeit a lower income level, but a much larger group. Because you simply can't get enough tax revenue on putting a lot of tax on the wealthy. There just isn't enough wealthy people out there to do it. The way you have to do it is push it down where there's a lot of people, and that's the middle class and the working class. Another slide here. Rhetoric versus reality on premium cost. The average annual cost of family health insurance premiums in the U.S. Here we are, 2012. This is what President Obama, in campaigning for Obamacare, said would happen, that you'd follow this blue line down and the cost would go down by $2,500. And what are we hearing from all the actuaries and the CBOs and others? Not only will it go up by $2,393, but we already have a differential of around $4,000 from where President Obama said we would be today and where we actually are. It hasn't gone down, it's actually gone up. All right, let's talk about a couple of more taxes, and then I'm going to introduce a colleague here and give him some sharing time as well. Surtax on investment income, $123 billion, which begins this past January. Creation of a new 3.8% surtax on investment income earned in households making at least $250,000 per couple or $200,000 single. Now this is the home owner real estate tax that you've heard about. It was again passed in the dead of night. Folks, this is a terrible tax, 3.8% on investment income. Now, when you sell your home, it may or may not be classed as investment income, but it can be. It just depends on the situation. But it's not just that. If you own any type of other property, if you own stocks and bonds, mutual funds, whatever, they could be easily subject to this, and it is not indexed to inflation. Again, let me reemphasize this. Yes, it's a tax on people who make over $200,000 a year. But if you make $50,000 a year, over time, this will affect you too, because inflation will bring those dollars up in real terms because of inflation, and your buying power will stay at the $50,000 level, but you will show on paper that you're making $200,000, and this tax will affect you. So the bottom line here is that Obamacare has many taxes, and certainly they are Trojan horses by any explanation. And that, yes, they don't raise a lot of revenue at first, but down the road they raise a lot of revenue, but not on the wealthy folks, on the middle class. That's who's getting hurt by Obamacare. A medicine cabinet tax, $5 billion beginning this past January. Americans no longer able to use their health savings accounts or flexible spending accounts and all those other types of accounts on over-the-counter drugs. So that means that if you want to use your health savings account to pay for your cold medicine or medicine you're taking for a headache like Aleve or Motrin or something like that, if you want to pay for it through your health savings account, you're going to have to go get a prescription from your doctor. And the doctor's going to say, look, I'm overwhelmed with all these people wanting me to do this. We're going to have to charge something for that, so that means more cost. Ultimately, more bureaucracy, more paperwork, more cost, and up until now, prior to Obamacare, that was not the case. You could write that off or pay for that out of your health savings account. An HSA withdrawal tax hike, $1.4 billion, that began in January 2011. It increases additional tax on non-medical early withdrawals from an HSA from 10 to 20%, disadvantaging them relative to IRAs and other tax advantage accounts. So you see, if you have an early withdrawal from your IRA or some other kind of retirement plan, you've had a 10% penalty, and that was true of HSAs. Well, that's been doubled. So Obamacare has limited the use of health savings accounts, but at the same time has made the penalties even steeper for using it. And I can tell you, in my own case, in my own companies, apart from my own medical practice, we have used health savings account to tremendous benefit to our employees because it has lowered their cost and taken a lot of the anxiety and the fear away from their cost and being caught in some sort of illness that would bankrupt them otherwise. An excise tax on charitable hospitals, that's immediate, $50,000 per hospital if they fail to meet new community health assessment needs. Section 1411 increases the Medicare hospital insurance portion of the payroll tax. So this provision will increase the employee's portion from 1.45% to 2.35% for families making more than $250,000 a year or individuals making above $250,000. Combined with the employer's portion, the total rate will increase by 3.8% on every dollar of income over $250,000. And again, I implore you, I realize, hey, I don't make $250,000. I don't make $200,000. But because of inflation, and trust me, with the monetary easing and the monetary policies that are coming out of this administration and have for the last 3.5 years, and inflation gets going again, which it will quite soon, you will be driven up into those income levels, but your buying power will be the same as it is today. So trust me, you're not getting by with anything. You're going to get hit with this tax just like everybody else. The reality is, and I'm going to be recognizing my good friend Dr. Gingrey here in a moment, reality is Obamacare includes tons of new taxes and tax hikes. Heritage has a list of them that shows an increase of revenue of more than $500 billion in 10 years. Two examples that clearly hit consumers are the 10% tax on indoor tanning services that will raise $2.7 billion between 2010 and 2019, and beginning in 2013, the 2.3% excise tax on manufacturers and importers of certain medical devices that will raise $20 billion between 2010 and 2019. And I'm just going to throw in a couple of more things. Remember, this discussion began with this being the April 15th, April 17th deadline for your taxes and the Internal Revenue Service. Remember that under Obamacare, as many as 16,000 new IRS agents will be hired. The estimates vary, of course, and that many has not been hired yet. But there's no question about it that the IRS will be beefed up to the tune of billions of dollars in order to make that happen. So with that, I've been joined by my colleague, my good friend, Dr. Phil Gingrey, an obstetrician gynecologist from Georgia, someone that I look up to very much, who's been a great mentor to me and a role model. Was here as a physician in days past when there weren't many doctors in the House of Representatives, and has helped facilitate, in fact, helped start the GOP Doctors Caucus, which is speaking here tonight, and helped grow our numbers from just a handful of physicians and healthcare workers to now over 15 MDs and upwards of around 20 total healthcare workers that we have in the House of Representatives that I think are making big, big differences and particularly health care policy overall. So with that, I would like to yield to the gentleman, Dr. Gingrich.
Mr. Speaker, I thank the gentleman very much for yielding, and I thank him for his kind words. I'm happy to share the time with him tonight and plan to remain here on the House floor for the rest of this hour. I'll make some comments now and yield back to the gentleman from Louisiana, Dr. Fleming, and maybe he'll yield some additional time to me later in the hour. But, you know, I couldn't help but notice in the previous hour, which was allotted to our Democratic colleagues, their leadership hour. They went first tonight, and they chose to talk about the SNAP program within the Department of Agriculture. And of course, SNAP is an acronym for the Supplemental Nutrition Assistance Program, which we formerly know, and I think more people would commonly know it as the Food Stamp Program. And they spent the whole hour talking about the unintended consequences of cutting discretionary federal spending and reducing government bureaucracy and bloatedness, and saying that, well, you do that, of course, you hurt the poor and the nearly poor, that they desperately need these programs. And you know, they made some legitimate points, of course, and we're talking about health care in our hour, and specifically about the passage of Obamacare almost 2 years ago, indeed a little more than 2 years ago now, to create a whole new entitlement program for people, the uninsured, not the folks that were covered under safety net programs like the program for children, the S-CHIP program it's called, the health care program for the poor, Medicaid, certainly not the program for our seniors and our disabled Americans under Medicare, but for folks that were somewhere in the middle, that maybe couldn't afford or weren't offered health insurance by their employer. But, you know, they never talked about the unintended consequences of what would happen. I'm sure our colleagues didn't intentionally pass a 2,600-page bill that would deliberately hurt anybody. I don't think anybody on either side of the aisle in any Congress would do that. Any administration would do that. But we physician members, the gentleman from Louisiana, myself, and others that have worked in the healthcare industry most of our professional lives before we got to Congress, understood far better and knew exactly what the unintended consequences would be of this legislation. Mr. Speaker, that's exactly what the gentleman from Louisiana has been talking about and pointing out in the poster presentation, the slide presentation that he has made. You know, I could probably take the rest of the hour talking about the unintended consequences and list them as my good colleague and our friend on the Senate side, the chairman of the Senate Policy Committee, also a physician, orthopedic surgeon from Wyoming, Dr. Barrasso, just recently came out with a white paper on health care policy dated March 13th, so just about a month ago. And Dr. Barrasso, in that paper, Mr. Speaker, lists 10 different unintended consequences. The gentleman from Louisiana has already mentioned a couple and gone over a couple, but I'd like to just take a few minutes before yielding back to him, a few of the promises that he has not yet mentioned. One, and this is a quote from President Obama, I will protect Medicare. In a 2009 address to Congress, President Obama promised that he would, quote, protect Medicare, unquote. Well, the President's health care law, however, Dr. Fleming may have mentioned this, takes more than $500 billion from the Medicare program and uses that money. Now, he said, and the Democrat majority at the time said, well, you know, we're strengthening Medicare, but yet over $500 billion, more than a 10% cut per year in Medicare over a 10-year period of time, took that money to create this new entitlement program. The Medicare actuary has actually written that the Medicare cuts cannot be simultaneously used to finance other federal outlays, such as the coverage expansion under this PPACA, and to extend the Medicare Trust Fund. You can't pay for two things with the same amount of money. I wish we could. Then maybe folks wouldn't have to be on food stamps, as an example. The Congressional Budget Office on that same point wrote, Medicare provisions in the President's health care plan, quote, and again, this is the CBO, would not enhance the ability of the government to pay for future Medicare benefits, unquote. President Obama actually admitted in an interview, you can't say that you are saving on Medicare and then spending the money twice. That's what the President said. But that's exactly what the law does. It spends the same money twice, undermining, unfortunately, a great Medicare program that needs to be strengthened and protected. That was one of the promises broken, promises made but not kept, as Dr. Barrasso, Senator Barrasso pointed out. Let me add one more. This is number 5 of the 10 that Dr. Barrasso mentioned in his white paper of last month from the Policy Committee on the Senate side. Candidate Obama said there was no need for a mandate. This is back in 2008 in that campaign against Senator Hillary Clinton. Candidate Obama opposed a mandate to buy insurance and made it one of the hallmarks of his primary campaign. He claimed that penalizing people for not buying health insurance, listen to this, Mr. Speaker, was like, and I quote, solving homelessness by mandating everyone buy a house. He said, President Obama, Senator Obama at the time, candidate Obama, solving homelessness by mandating everyone buy a house. Well, this is like, you know, solving the uninsured problem by mandating that all the rest of us pay for health insurance for a lot of people that could afford to buy health insurance but just simply did not want it. I don't know how many millions of people make more than $50,000 a year or $75,000 a year that really don't want, would rather pay as they go. I don't recommend it. Dr. Fleming doesn't recommend it, Mr. Speaker. We think they ought to have some minimal coverage and certainly catastrophic coverage, but you know, this is their right, their liberty to choose if they want to not to have that coverage. And President Obama's health care law, as we all know now, created an unprecedented federal requirement for all citizens to purchase a product merely because they exist, because they're living and breathing, and not just a product. They couldn't, under this bill, when it's fully implemented in 2014, the minimal coverage requirement, as the gentleman from Louisiana pointed out, wouldn't allow them to, let's say, to have a mini-med policy, as many of the franchisees do across this country in the fast food industry. They all had to be granted waivers. So here again, another promise made and not kept. I have a couple more that I'll get to maybe later on in the hour, but just to point that out in clearly, the Supreme Court, I think, now understands much of that in the testimony they heard a couple of weeks ago. So I'll yield back to my colleague and stick with him during the remaining portion of the time.
Well, I think my remaining colleague will certainly be turning back to you for some more information. That's very valuable information. And I want to get back to and sort of recap some of the things I talked about, and that is that the taxes are tremendously increased under Obamacare. Well, let's talk about the financing of Obamacare. And I'm just going to stick with the basics. There's a lot of ways it's theoretically financed, but I'm going to tell you maybe the 3 major ways that it's supposedly paid for. Well, number one, You heard my friend Dr. Gingrey say that Obamacare actually takes over $500 billion, that is, over $500 billion from existing Medicare, and uses that to subsidize the middle-class health plans for people below a certain income level. And we're going to get to that in just a moment. I'm going to draw your attention to this chart and talk about those subsidies. But not only does it do that, but as my good friend says, it's used to extend the life of Medicare. So this is basically how it works. The idea of the bill is it takes money out of Medicare and theoretically makes Medicare last longer because it's running out of money by taking the same money out of the middle and putting it at the end. I don't understand how that could work, but that's the way it works. That would be sort of like taking money out of your paycheck in the middle of the year and somehow living on nothing for about 3 months and then going back to what you took out and paying at the end. It makes no sense. But not only that, but it takes the same $500 billion, and we've really honed down on this in our committees, and Secretary Sebelius had to admit that this was true. It takes the same $500 billion that's used to prolong the life of Medicare to subsidize middle-class health plans. I don't know, where I come from in Louisiana, we can't spend the same dollar twice. You can spend it place A and place B. My kids want to go to the movies, or they want to do some entertainment, or maybe they need money for their education. I can give it to them. They can spend it one time. They don't get to use the same dollar twice. And folks, neither can your federal government. So that is really smoke and mirrors accounting, and we've called them out on it, and they've really basically admitted that's true. But then another way that Obamacare is paid for is by over $800 billion of taxes in 10 years, which I've gone over a number of these, and I'm going to get back to them. It really is not paid for, and we know we're getting estimates now that showing that as much as $300 to $500 billion are going to be added over the next 10 years in deficits, total debt in that period of time. So it is not paid for. All of these steep taxes, all of these smoke and mirror types of accounting are not going to work. And furthermore, half the people who are going to get health care coverage cards that they wouldn't otherwise get are going to be on Medicaid. And today, Medicaid pays on average about 60% of what Medicare pays to health care providers, which is already too low. And so what's the chance that 15 million Americans are going to come newly on the rolls, and they're going to carry a card around that pays less than what the doctor can afford to accept to even cover the cost of that care and otherwise go out of business? What's the chance they're going to find doctors? And so what we'll have is a drop in the number of physicians, a steep rise in the demand in health care, and so these people will all end up in emergency rooms. To my colleagues, it's one thing to have coverage in health care. It's another thing altogether to have access to health care. And all you have to do is look at other countries who have socialized health care, Great Britain, Canada, and many others, and even go to the extreme steps of Cuba and North Korea. They all have coverage, and it's free. The problem is there's no access to it. There's shortages. There's waiting times, as much as a year, 2 years to get a CT scan. People are dying as a result of that, and they show up in their statistics. The death rates, for instance, from breast cancer and prostate cancer in the United States are much lower than they are in Canada and Great Britain. They have access to the same medications and the same quality physicians. The only difference is their health care systems themselves. So let's get back again. I want to really focus on this topic for a moment before I yield time to my friend. And again, back to this idea that many of the taxes are going to be placed upon the wealthy Americans in order to pay for Obamacare. And I'll just step back through them again. There's a 40% excise tax on so-called Cadillac health plans, which would be health plans valued in excess of $10,200 for individuals, $27,500 for families. Those thresholds will grow annually by an inflation rate of 1%, which is about a third or less of what it really is. So what that means is that as Obamacare unfolds, having an expensive gold-plated Cadillac health care plan, you're going to get taxed 40% more for having it. Well, maybe that's justified, but remember that after a few years, that will not be an expensive gold-plated plan. That'll be an average plan. And you will, again, still have to pay the same 40% excise. Bracket creep is what they called it back some years ago, and I think it applies here today. Now, again, increases in Medicare hospital insurance. That's a payroll tax on people who make $200,000 a year individually, $250,000 as a couple. Again, only applying to people who are in that 200,000 plus range. And then, of course, I told you the 3.8% tax on your investments that are sold for those who, again, make $200,000 or more. And again, we go back to it. Remember the alternative minimum tax. Remember the luxury tax. Remember the tax that was placed on oil, the so-called windfall taxes. Ultimately, those taxes all fell to the middle class and below. Those are the ones who were burdened with them, and why most of them have been repealed. And we would repeal the alternative minimum tax if we could find a way to actually pay for it now, because we're spending at a level that we can't afford to repeal it, unfortunately. So here's this chart, which is very important in this whole discussion. Under Obamacare, there's an income threshold for receiving subsidy. So if your income is just below $100,000 for a family of married couples, and I believe that's a family of 4 total, if you make less than $100,000, or about $95,000 here, you'll get some kind of subsidy beginning in 2012, 2013. However, that subsidy, that line continues out all the way indefinitely, well past 2062 and before. Now, if you make $90,000 or less than $90,000 today, with inflation in those out years, 5 years, 10 years, 20 years, 30 years, you will break through this threshold. So you will not get the support, the subsidy in your health plan in those out years. You'll get it early so that you think you're getting something. But ultimately, that's going to basically go away, and you will not get that subsidy. Now, also, if you make $200,000 or $250,000 a year, you will be the one paying in for those who need this subsidy. But you see this line comes down, because people who make $200,000 today in 2022, they'll still get a check that'll say $250,000, but it'll be more like $180,000 in today's dollars. And with each year, it ratchets it down until finally you get to about 2042 or 2050, in that range. And so a check today that says $200,000 on it will buy equivalent to something like $90,000 in those years, because inflation devalues the actual currency that you hold. And so what you get is a crossover point where you see the subsidy threshold gets higher and higher. You've got to make more and more money to get that subsidy, but even though your income is the same or going down, you actually drop out. You get a crossover point where here, even though you're making $200,000 or $250,000, you're making too much for the subsidy, but you're not making too much to be taxed. And that is the problem. Ultimately, Obamacare, over time, begins to take the subsidies out for those who are middle class and lower, and it begins to add taxes on those who are middle class and above. And that is very destructive, my friends. That's the way you end up with socialized health care and the kind of system that's working so poorly in many other countries. We still have time to discuss some of these issues further, and I would ask my good friend from Georgia, Dr. Gingrey, to elaborate on some of his points tonight.
Mr. Speaker, again, I thank the gentleman for yielding to me, continuing on the line of reasoning that Dr. Fleming just outlined, talking about not indexing these benefits for inflation. But in fact, another thing that needs to be pointed out is that under current law, in creating these exchanges and trying to help people who are uninsured because it's not affordable to them, we, the taxpayer, are going to subsidize people that purchase health insurance in these state exchanges, even if they make up to 400% of the federal poverty level. For a family of four, Mr. Speaker, that's $85,000 to $90,000 a year. I think if John Q. Public knew that we were forcing them to subsidize the purchase of health insurance for people making up to $90,000 a year, they would be appalled. But that, in fact, is the case. And the other thing, in just continuing what my friend from Louisiana was talking about, is it also, the law, expands the Medicaid program to 4 states. Some states in past years, when times were better, were covering people on the Medicaid program more than 100% of the federal poverty level. Indeed, some up to 185%, maybe even 225% of the federal poverty level when they could afford it. But to actually say in times like these that we're going to force the states to cover people up to 133% of the federal poverty level when they can barely afford to cover at the 100% level is an unfunded and probably unconstitutional mandate. And, Mr. Speaker, as you know, my colleagues know, on both sides of the aisle, this was part of the argument before the Supreme Court, as well as that more publicized argument against requiring individuals to engage in commerce under the rules of the Commerce Clause. So, you know, that's a huge problem, and as Dr. Fleming points out, and the Speaker, will become even more of a problem because it's not indexed for inflation, and you have more and more people being subsidized. I want to get back, though, if the gentleman will allow me a little bit more time, to those failed promises that I discussed a little earlier. The Republican Health Care Policy Report from Senator, Dr. Orthopedic Surgeon John Barrasso that he put out just last month. Let me go straight to number 10. We mentioned a couple. Broken promise number 10. Get this, colleagues. And this is a quote from President Obama, our 44th president. These negotiations will be on C-SPAN. Candidate Obama promised to televise all health care negotiations on C-SPAN. The process that created the president's health care plan was plagued, unfortunately, and it wasn't on C-SPAN, with backroom deals like the Cornhusker kickback, Gatorade, and the Louisiana Purchase, cutting special deals with senators from certain states. You don't have to be a genius to figure out what those 3 states are. The president indeed even conceded the process, and he said, legitimately raised concerns not just among my opponents, but also among supporters that we just don't know what's going on. And it's an ugly process, and it looks like there are a bunch of backroom deals, unquote. Mr. Speaker, there were a bunch of backroom deals. And I think our colleagues are aware, we got a memo today from my committee, the Energy and Commerce Committee, and particularly the Subcommittee on Oversight and Investigation. And we have been trying for almost 2 years, the committee staff on Energy and Commerce, Subcommittee of Oversight and Investigation, to get information from the White House about all of these backroom deals that were cut, negotiated during the process of getting buy-in from stakeholders that everybody in the country would recognize. Now, I'm not pointing fingers or saying that anybody necessarily did anything wrong, but you know, our own American Medical Association, the American Hospital Association, the American Health Insurance Plans, AARP, which represents 37 to 40 million seniors, all of these advocacy stakeholder groups were in these back rooms, and promises were made, policy changes in the law in exchange for something special for them. I mean, again, Congressman Fleming talked about sausage making in the legislative process, but the President promised that all of that would be out in the open. Indeed, he said it would even be televised on C-SPAN. And here again, that's promise number 10. And all we're asking from the White House, the Office of Health Care Reform, I think Deputy Chief of Staff Nancy Ann DePaul was a director of that effort in the White House, and they have done nothing, Mr. Speaker, for the last 2 years but stonewall. And we are going to continue to ask for documents of what went on behind closed doors, so we the people, the American people, can understand how this possibly could happen and what now we know are the unintended consequences. Dr. Fleming has pointed out in his presentation and his slides in regard to the taxation, in regard to people thinking that if they like their health insurance they could keep it, and only to find out that they can't, whether they're on Medicare Advantage or whether they get their health insurance from an employer, or whether they're working and paying $15 to $20 a week for a minimal coverage plan that has catastrophic protection. And all of those, without waivers, all of those plans will be taken away from people even though they like them. So again, the problem is unbelievable. The unintended consequences are unbelievable. Unfortunately, you better believe it because they happen. And I yield back to my friend.
Would you touch a moment, Dr. Gingrey, about